Hello, I'm Helen Marie Merritt, a cardiac surgeon from the University of Nebraska Medical Center. The next ask under this advocacy priority is for co-sponsorship of the Reducing the Youth Tobacco Epidemic Act. This bill was introduced by the House Committee on Energy and Commerce Chairman Frank Pallone Jr., a Democrat from New Jersey, and by Representative Donna Shalala, a Democrat from Florida, and former Secretary of Health and Human Services. Since a companion bill has not been introduced in the Senate, you will only talk to your representatives about this bill. E-cigarette use entered the U.S. marketplace around 2007, and since 2014, they have been the most commonly used tobacco product among U.S. youth. E-cigarette use among U.S. middle and high school students increased 900% between 2011 and 2015. Current e-cigarette use has increased 78% among high school students during the past year, from 11.7% in 2017 up to 20.8% in 2018. In 2018, more than 3.6 U.S. youth, including 1 in 5 high school students and 1 in 20 middle school students, used e-cigarettes. This spike in e-cigarette use has resulted in youth nicotine use holding steady, even as the number of kids who smoke cigarettes has declined. In 2018, the FDA described teen use of nicotine as an epidemic. Nicotine exposure during adolescence can harm the brain, which continues to develop until about age 25. Nicotine exposure can impact learning, memory, and attention, and also increase risk for future addictions to other drugs. In addition to nicotine, the aerosols that users inhale and exhale from e-cigarettes can potentially expose both themselves and bystanders to other harmful substances, including heavy metals, volatile organic compounds, and ultrafine particles that can be inhaled deeply into the lungs. Many e-cigarettes come in flavors that appeal to children. The Reversing the Youth Tobacco Epidemic Act takes a multi-pronged approach to preventing nicotine addiction in young people. The bill would raise the federal minimum age for purchasing tobacco products to 21, as 14 states and hundreds of cities have already done. This would help prevent middle and high schoolers from accessing nicotine products and would result in 223,000 fewer premature deaths, 45,000 fewer deaths from lung cancer, and 4.2 million fewer years of life lost for those born between 2000 and 2019. The bill would also prohibit flavors in tobacco products, including menthol. Many kids point to flavors like cotton candy and berry as a major draw of e-cigarettes. Another provision of the bill would require the FDA to issue final regulations prohibiting online sales of all tobacco products. This provision is intended to enhance protections against underage sales, as many young people currently get their nicotine products online. The bill would require the FDA to finalize rulemaking to implement graphic health warning for cigarette packages. Ongoing litigation has delayed the FDA from implementing the Family Smoking and Tobacco Control Act's requirements that graphic health warnings be added to cigarette packages and advertisements. The bill would prohibit the distribution of non-tobacco merchandise that bears a tobacco brand name or logo, tobacco product brand sponsorship of athletic, music, or other concert events, the offer of free gifts in consideration of purchasing tobacco products, and tobacco product advertising or labeling in non-traditional mediums without notification first being sent to the FDA. Just like cigarettes, e-cigarettes should not be marketed to kids in sneaky ways. The bill would likewise prohibit advertising or promotion of e-cigarettes to anyone younger than 21, and it would prohibit e-cigarette products from being marketed, advertised, promoted, or endorsed without clear disclosure that the communication is an advertisement. This section would give the Federal Trade Commission the authority to implement these prohibitions and seek civil penalties for violations of statute, and it would allow states' authorities to enforce the law. Finally, the bill would grant the FDA authority to collect user fees from all classes of tobacco products, including e-cigarettes. It also increases the total amount of fees collected by $100 million. Drug manufacturers pay the FDA these fees in order to submit new applications for approval. FDA currently collects user fees from manufacturers and importers of cigarettes, snuff, chewing tobacco, roll-your-own tobacco, cigar, and pipe tobacco, but not for e-cigarettes. While you're on the Hill, you may encounter opposition to this bill. Many members of Congress from both sides of the aisle receive money from the tobacco industry lobbyists. The provisions in the Reversing the Youth Tobacco Epidemic Act would negatively affect the industry's bottom line. Lisa Lacasse, president of the American Cancer Society Cancer Action Network, said, "The Reversing the Youth Tobacco Epidemic Act of 2019 contains provisions that would put critical safeguards in place to keep tobacco products out of the hands of our children. The bill would also include necessary and appropriate scrutiny of the advertising and marketing practices of the profit-driven tobacco industry and its allies. Chairman Pallone is a steadfast champion of public policy solutions that aim to improve the public health of our nation, and we applaud him for bringing forward legislation that would better protect our kids from the dangers of tobacco use. I hope you will ask your legislators to co-sponsor this far-reaching bill. The final ask in this advocacy priority is to co-sponsor the bipartisan Tobacco to 21 Act and/or the Tobacco-Free Youth Act in the Senate. Just like the Reducing the Youth Tobacco Epidemic Act in the House, these bills raise the federal minimum tobacco purchasing age from 18 to 21. Unlike the House bill, that's all they do. The Tobacco to 21 Act was introduced by U.S. Senators Brian Schatz, a Democrat from Hawaii, Todd Young, a Republican from Indiana, Dick Durbin, a Democrat from Illinois, and Mitt Romney, a Republican from Utah. The Tobacco-Free Youth Act was introduced by Mitch McConnell, a Republican from Kentucky, and Tim Kaine, a Democrat from Virginia. Raising the minimum purchase age to 21 protects children and teens from exposure to nicotine and has been shown to save both lives and money. It's one important component of a comprehensive strategy to reduce the youth e-cigarette epidemic and continue to reduce tobacco use in the United States. For such legislation to be effective, it must include strong enforcement provisions and penalties on tobacco retailers who sell to minors, not on the young people who have already been victimized by the tobacco industry. It should also prohibit tobacco sales to anyone under the age of 21 without exceptions. The Tobacco to 21 Act and the Tobacco-Free Youth Act meet all these criteria. It is worth noting that Senator McConnell's Tobacco-Free Youth Act requires states to also pass their own Tobacco to 21 bills or risk losing federal funding for substance abuse. This provision opens the door for the tobacco industry to influence state bills. This is troubling, and the society would prefer that this provision is dropped. Please ask your senators to co-sponsor one or both these bills and get them over the finish line.